Alrighty, good afternoon, everyone. Welcome to this month's Research Matters. I'm Erica Salzik, and I'm the Department Administrator for UT Southwestern's Human Research Protection Program, and I will be one of the moderators for today's session. So as usual, I'm going to go over a couple of housekeeping items really quickly. If you have any questions for our presenters, please type them in the Q&A. One of the moderators will respond to you during the session, or we will address it at the end of the presentation. This session is recorded and will be available immediately after the conclusion of the live session by clicking on the Microsoft Teams live link in the Outlook appointment. We will send the slides and handouts out via the listserv, and you will also be able to access the slides and recordings on HRPP's Research Matters website, which can be found under the Training and Resources page. We do provide a certificate of attendance for those who have logged in using a valid email address. If you do not receive one via email but should have, please send an email to hrpp@utsouthwestern.edu to request a certificate. And lastly, we want to hear from you. We're interested to know what topics you would like us to cover during these sessions. We're getting some great ideas and are preparing for our fiscal year 24 calendar topics. We want to know how our speakers did and how our office is doing. So if you can please take a few minutes to complete the survey and provide your feedback, that would be amazing. You can also access the survey via your phone using the QR code or your computer by selecting the link. And I'll drop in the link for the survey in the Q&A in just a moment. Here is the agenda for today. Today, Rasija Nambiar and Raj Varadarajan from the Regulatory Support Office will continue with part 3 of the 6-part mini-series of the FDA IDE regulatory process. This month, they are going to cover modifications to IND and IDE. For our feature topic, Satish Birla is going to be talking about social media used in research. And we will conclude with an open Q&A session. So I'm going to turn it over to Rasija and Raj.
Good afternoon, everyone. Today, our Regulatory Support Office, our RSO team, will continue with the 6-part mini-series on FDA IND IDE regulatory process. And our today's talk will cover part 3, how to submit modifications to IND or IDE. As you all are aware, sponsors of IND are responsible for informing FDA when IND is amended. I will discuss different types of IND amendments and how to successfully prepare each IND amendment to FDA. Raj will be covering the IDE amendment portion for device studies. As discussed previously, this is the IND lifecycle, and throughout this mini-series, we will talk about each of these steps in detail. We covered step 1, 2, and 3 in our recent Research Matters, which you can watch the recorded video that is available on our website. Our today's focus is on step 4, which is the IND maintenance period. And this is a quick summary of step 4, the IND maintenance period, which I'll be explaining in detail in the next few slides. There are 4 major types of IND amendments as listed here. The first one is protocol amendment, new protocol. Next is protocol amendment, changes in existing protocol. The third type is protocol amendment, new investigator. And the fourth one is information amendment. These are the timelines for each type of amendments listed for your reference here. It is important to keep in mind that a protocol change intended to eliminate an apparent immediate hazard to human subjects may be implemented immediately, provided that the FDA is subsequently notified by protocol amendment and the reviewing IRB is also notified. Now, I'm going to go over each amendment in detail. Let's start with the first type, that is protocol amendment, new protocol. So what is this? This is the case where if a sponsor of IND intends to conduct a study that is not covered by a protocol already contained in their IND application, the sponsor is expected to submit to FDA protocol amendment containing a copy of the new protocol and a brief description of the most clinically significant differences between it and the previous protocols. As you all know, the sponsor can have more than one protocol associated with same IND as long as new protocol is studying the same drug for same indication. For example, of a new protocol amendment would be when clinical trial transitions from phase 1 to phase 2. Sponsor of IND must submit protocol amendment, new protocol, because it is a new protocol with new objective and endpoints, but using the same drug for same indication. In this case, sponsor of IND must submit new phase 2 protocol to FDA and obtain IRB approval before beginning phase 2 clinical trial. Please keep in mind that unlike initial IND submission, there is no required 30-day clock with a new protocol amendment. So once sponsor submits it to the FDA, sponsor does not need to wait 30 days to begin clinical investigation. However, it is encouraged to check with your FDA project manager before proceeding to ensure that the review team does not have any concerns. It is considered a best practice to wait approximately 30 days after submission of a new protocol before starting the study. I would also like to highlight that FDA and IRB submissions may occur in any order. This is a frequently asked point by most of the study teams. But the best practice is to have IRB approval first and include approval letter in protocol amendment submission to FDA, which is required by CBER. Next, coming to protocol amendment, new protocol package. This should include cover letter, which includes a brief description about new study. And as I mentioned in previous slide, if the sponsor desires FDA to comment on a submission, they should submit a request for such comment within the cover letter itself and the specific questions that the FDA's response should address. This package should also include the full clinical protocol, must include Form 1571, that is the contractual agreement between sponsor and FDA, Form 1572, that is a contractual agreement between investigator and sponsor. Form 3674, that is certification of registration at clinicaltrials.gov, and informed consent template. These 6 documents are the ones that need to be included in this package. I just also wanted to quickly show this section within Form 1571 that is utilized to indicate protocol amendment, new protocol, while including in this package. The next type of protocol amendment is changes in existing protocol. Per regulations, once an IND is in effect, a sponsor shall amend it as needed to ensure that the clinical investigations are conducted according to protocols included in the application. Protocol amendments should be submitted to the FDA when a phase 1 protocol changes significantly that affects safety of subjects, or in a phase 2 or 3 protocol, changes are made which significantly affect safety of subjects, the scope of the investigation, or the scientific quality of the study. For example, any increase in drug dosage or duration of exposure of individual subjects to the drug beyond that described in the current protocol, or any significant increase in the number of subjects under study, then any significant change in the design of the protocol, such as addition or elimination of a control group. Another example is addition of a new test or procedure intended to improve monitoring for or reduce the risk of a side effect or adverse event, or elimination of a test intended to monitor safety. However, it is considered a best practice to submit all protocol changes to the FDA. Like protocol amendment for new protocol, there is no required 30-day clock with a change in protocol amendment. But again, it is always better to check with your FDA project manager before proceeding to ensure the review team does not have any concerns. Protocol changes may be implemented following submission to FDA and IRB approval, except for the emergency situation to eliminate an immediate hazard to participants. Once again, the FDA and IRB submissions may occur in any order, but the agency prefers obtaining IRB approval first and including IRB approval letter in the protocol amendment. Change in protocol amendment package should include cover letter, which includes, again, a brief summary of changes and rationale for the proposed change. Form 1571, revised track protocol, and a revised clean copy of protocol. I just also wanted to quickly show this section within Form 1571 that is utilized to indicate protocol amendment change in protocol, which while including in this package. The third major type is protocol amendment for addition of new investigator that is submitted when a new investigator is added to carry out a previously submitted protocol, except for a treatment protocol such as single patient, intermediate, and large population expanded access protocol. The amendment should include the investigator's name, the qualifications to conduct the investigation, and any reference to the previously submitted protocol if relevant. FDA should be notified within 30 days of the investigator being added. This is relevant for multi-center studies. Sponsor must collect and submit Form 1572 and CV of the investigator from each research site to the FDA. Sponsor must also collect IRB approval letter from each research site prior to shipping investigational drug. The best practice is to include IRB approval letters with FDA submission. Protocol amendment new investigator package should include cover letter, Form 1571, 1572, and investigator CV. And in Form 1571, you would select the box for new investigator under protocol amendment section while including it in this package. The last major type of IND amendment is information amendment. This includes any amendment to an IND application with information essential to the investigational product that is not within the scope of protocol amendments, safety reports, or annual reports. For example, information amendments to IND applications may include new toxicology, chemistry, or other technical information, or a report regarding discontinuance of a clinical or non-clinical investigation. Any information amendment submitted under an IND application is required to bear prominent identification of its contents. Example, it should be identified as information amendment, chemistry, manufacturing and control, or information amendment, pharmacology, toxicology, or information amendment, clinical. It can be submitted as necessary, but not more than every 30 days if feasible. Information amendment package should include cover letter. Again, sponsor should clearly state the purpose of the amendment and request for FDA comment if the sponsor desires FDA to comment on an information amendment. Form 1571, revised track protocol, and clean copy of the protocol. Sponsor should summarize and present data in a format appropriate for scientific review. In Form 1571, you would select the applicable checkboxes under Information Amendment section as seen here while including this form in your submission package. Once the study team puts together the IND protocol or information amendment package using the templates provided by us or that is available on our RSO's website, you may contact our RSO team for review. Then, when review is complete, the next step is to submit the amendment package to the FDA, which we can assist by submitting via the CDER NextGen portal for drugs and via CBER email directed to an FDA receiving hub, that is the CBER Document Control Center. If you all are interested in learning more about ways to submit to CDER and CBER, please watch our last month's Research Matter presentation that is now available on our website. And this concludes my portion. Thank you all for listening, and I'll now pass it over to Raj to talk about the IDE modifications.
Thank you, Rasija. Good afternoon, everyone. Before getting into the details of IDE modifications, I wanted to touch on a few basic points regarding the device-related amendment process. In addition, I would like to explain why and how communicating amendments to the FDA differs from those of the IND, and what is the reason the process could be somewhat confusing. Here are some facts. The device side of regulatory steps is complex, with many variations, parts, and features to be customized to match with certain requirements. Because of this complexity, unlike IND amendments, device amendments have some submission formalities and wait times for FDA reviews, requiring explicit approvals prior to implementing changes. In addition, there are multiple amendment submission paths to consider for communicating the changes to the FDA. With that background, let's move to the familiar graphic, the IDE life cycle, where the step 4 includes amendments, which are executed during the trial and study maintenance period. Now, let's see what the key regulatory milestones are in the maintenance phase. The IRB update and the concurrent update of the clinicaltrials.gov records. These are to be accomplished in the post-IDE approval phase. In addition, on the FDA side, there are quite a few requirements for reporting and implementing changes, which must strictly follow certain stipulated schedules. Here is a quick summary of step 4 activities during the IDE maintenance, indicating the different FDA communication schedules for certain regulatory tasks aside from those for the IRB and clinicaltrials.gov updates. I'll talk about these FDA regulatory activities in detail in the next set of slides. Essentially, there are three categories of IDE modifications, each tied to a specific timeline, which are: number one, an amendment submission option with a 30-day wait time for some changes, requiring prior FDA approval before implementing those changes. The second one, this is another submission route via amendment notice to the FDA involving a timeline requirement of no later than 5 working days after making the changes. And the third, submission of IDE modifications included as a part of the annual report or progress report, which happens at least once a year. This is a very key difference. This is not allowed in the IND amendment, any of the categories of the IND amendment. RSO can assist the study team in the process. RSO team assisting the study team pretty much follows the FDA guidance for the content and the type of modifications to consider and advise on the approval requirements. You are also welcome to access this yourself for more guidance details if interested. Now, let's look at the 30-day approval category, governed by a set of regulatory specifications. In general, this path is required for changes involving the device or protocol, which could impact the data validity and scientific soundness, and such changes impacting the subject's rights, safety, or welfare. For example, changes in device can be in the design, manufacturing process, thus affecting the basic principles of device operation, or such changes increasing the potential risks or introducing new risks. Changes in protocol can be associated with indication change, type or nature of study control, primary endpoint, statistical methodology, or adding new components to expand the study, or early termination, as well as adding a new clinical protocol. These changes are submitted in an IDE supplement to the FDA. IND amendments requiring a 5-day notice. This is category number 2 in the amendments, and this is governed by a different set of regulatory specifications, which cover multiple scenarios. For example, any emergency change to be introduced for protecting the life or physical well-being. And then a device or protocol changes not impacting the data validity, scientific soundness, and those not affecting the subject's rights, safety, or welfare. The following scenarios fit this amendment category, which are device design or manufacturing change, inclusion-exclusion criteria change, addition of backup safety feature to study design, or increasing frequency at which the information is gathered. Governed by yet another set of regulations, the third category of amendment submission is associated with the IDE annual or progress report. It will cover scenarios not affecting the scientific soundness of the investigational plan, in addition to the subject's rights, safety, or welfare. These are typically only minor changes. For example, monitoring procedure change, device name change, not even implying any change in intended use, inclusion-exclusion criteria change, minor changes to study purpose or objectives without changing the protocol or endpoints, IRB information, minor changes in the duration of investigation owing to the possibility of a long time anticipated for annual report submission, and then risk analysis. When it comes to submissions, amendments subjected to the 30-day review require an IDE supplement package. It is the most elaborate submission item, actually, like a mini IDE application. However, this supplement package is only focused on significant device design or manufacturing changes or protocol changes in terms of the various parameters that we went over. It is important that the supplement package submission is not made in response to the information from the investigation. The supplement package will include the Form 3514 or cover sheet, a custom letter, and a full description of the changes with appropriate graphics, sketches, and tables. One of the key requirements is the e-copy. Sorry, all AD submissions can be by regular mail to the CDRH or CBER, depending on the product addressed to the respective agency division offices, or filed through the CDRH customer collaboration portal. In part 2 of our mini series, we discussed the details of the customer collaboration portal and the key requirements for that. Amendment submission through the customer collaboration portal, we have seen what the requirements are, and the e-copy format is one of the requirements that we went over, and the details of this particular area can be accessible through the previous presentation. In any event, RSO can assist the investigator team in making sure of the e-copy format for your amendment documents in addition to submitting the amendments. Please complete the booking online to engage us for this purpose. That brings us to the close of this part 3 segment of the mini-series, which we certainly believe is also something fitting with your study needs. Very importantly, your feedback is critical for this presentation as well, to highlight on the quality of the content and presentation, which we greatly appreciate. As you know, we look into the Q&A via Teams chat or email. Our next mini-series presentation, scheduled on June 20th, will discuss safety or incident reports. We'll be very happy if you could make the time to attend that as well. And in addition, we have our future presentations coming. As you see, there are only 2 more left after the next one. And one last reminder for the archives of all the Research Matters presentations, please access through YouTube at the UT Southwest HRPP site and the SI support site. Now, let me turn over the Research Matters presentation to Satish Virala for continuation. Thank you all very much.
Thank you, Raj. Hello, everyone. Good afternoon. My name is Satish Vela, and I'm one of the senior regulatory analysts at HRPP office. And today's topic is about social media use in research. And let's go to the objectives of this topic. So I will start with the definition and the background of what is social media and everything, and then what is the applicability in the IRB review world. And then when it comes to the social media research reviewed by UT Southwestern IRB. What are the things we look for and what are the considerations used to carry out the study procedures? And finally, we'll end up with HRPP policies. So what is the term social media refers to? It is internet-based mode of communication that allows users to interact with a medium, typically a website or other users of the medium. So some of the applications and web tools which are free and are based on different overlapping. Sometimes there is a purpose for that and variably grouped into online communities like patient support groups, population specific dating services, and some of them are social networking like Facebook, Twitter, and some professional networking like LinkedIn, and some of them are YouTube or Tumblr where the content production and sharing are involved, and some of them are location based services like Tinder. And we have recently discovered where there are many other platforms where you can use social media as a chat or messaging or any other networks like Snapchat or any content. And many social media web services contain one or more platforms that allow users to view one other's networks and interact with each other in real time. So these include common spaces, chat rooms, discussion forums, and many like. So what is the background? Like what is important, why it is? So social media can include blogs, podcasts, and text messages. And if a researcher wants to use those blogs or use for their research portal, then that can be called as a social media research. And social media can provide unique tools for recruiting study participants. We have seen many researchers, they use Facebook as one of the recruiting materials or recruitment tool. And that's one of the easy platform where you can recruit the participants. And also social media can also provide tools to carry out research remotely. These are the useful things for social media and how this is applicable. Social media is used for accessing and also creating the user exchange data through different social media platforms like emails, videos, file sharing, blogging, or any patient focused discussion groups as well. So does the use of social media to carry our recruitment or research will require IRB? What would be the answer? So yes, any kind of social media which is used for recruitment and to conduct research will require the IRB review. So how and what is the platform and how do we use it? So let's discuss about this process right now with the process of recruitment. So the RBA application should specify which social media sites will be used and why they are used, whether advertisements of the study will be used, and how targeted recruitment will be conducted. If applicable, recruitment advertisement posts on social media may draw global participation. So if you are focusing on the global participation, so we need to see those advertisement posts on social media as well. Because of this, investigators should specify how they will ensure only eligible participation in the preferred geographic region will be recruited. So we need to know if you are targeting only specific groups of people. So how are you targeting them? What is the platform you are using? What kind of tools are you using for those specific region people? So typically this can be addressed by the inclusion of appropriate eligibility criteria as part of a screening survey. So when using social media to recruit, researchers should put forward the safeguards in place. And what are the safeguards we will discuss with the additional safeguards for consideration. Investigators should be aware that they may receive surveys, replies from malicious accounts or fictitious accounts or be the target of harassment or other trolling behavior seeking to discredit the study. So to avoid those, to address these concerns, so one of the thing is compensation for participation may be one of the tool that researchers should think about it. And also when it comes to compensation, we need to look about the compensation as an IRB. We review that compensation, how and what is the compensation amount you're giving for the participation, those kind of things. And also when it comes to monitoring of these advertisements and posts. So regular and routine monitoring is required for the study, and also understanding the policies regarding the privacy issues, any harassment or reporting on the channel being used, and adopting mechanisms to moderate posting on public forums related to any kind of research. And if surveys are used, users should take advantage of security measures to prevent fraud and mitigate malfeasance. So, for example, they can use completely automated public Turing test questions, so which may be prevent for the malfeasance or fictitious online content in submitting their responses. Like a participant, when they submit, you don't get any kind of content like very um, malfeasance or fictitious content. So in addition, proactively monitoring times of completion can be useful, as in our experience, completion rates are typically very fast for fake accounts. And it is important to monitor the referring links to determine if the links are being reshared or any fraudulent purposes for any fraudulent purposes. And several surveys also allow investigators to prevent multiple submissions from one device by using cookies. And researchers should acknowledge the disclosure of terms of sites or apps before advertising recruitment on them to avoid third-party data sharing. And for example, research participants who engage with studied advertisements could depend on the type of advertisement, and social media site allow third-party sites to collect information about their interests or affiliations unknowingly. So participants are often unaware of these terms of the apps and sites they use regularly. So investigators should be knowledgeable of these terms before they advertise their studies on these sites. And also they have to be maintaining the privacy and confidentiality when it comes to using their studies for the purposes of the data sharing or data usage. So how we review when it comes to the advertisements, like what are the considerations to be required? So recruiting activities are beginning of the informed consent process. So IRB needs to review social media advertising and recruitment to ensure advertisements are not unduly coercive, do not promise or imply a favorable outcome or other benefits beyond what is contained in the protocol, and do not communicate the study product is safe or effective for the purposes under investigation, and do not make claims that the study product is known to be equivalent or superior to any other study product. Do not include language indicating that the regulatory authorities such as the FDA and the IRB have approved this research. Do not cause the therapeutic misconception, that is, modifying the word treatment with a word that does not imply a benefit, or explain that a term like new drug means that the study drug is investigational. And do not promise or imply free medical treatment when the intent is only to say subjects will not be charged for participation in the investigation. Do not emphasize the payment. Provide information limited to that which subjects need to determine their eligibility and interest. And do not include the statements which are generally misleading. So what are the types of information we review? So the information is what is contained in the advertisement. When it comes to you want to post an advertisement, what is the information is about? What is the mode of communication? And we have to review the final copy of the printed advertisements. And if there are in audio or visual taped advertisements, we have to review them as well. So what you can include in that advertisements, the name and address of the investigators and our research facility, and a summary of the purpose of the research and basic eligibility criteria, a brief list of participation benefits, if any. Example, a no cost health examination, the time or other commitment required for the subjects, the name and phone number of the person to contact for further information. And review generally required for direct advertising. The information is presentable in many direct forms, and where it is like Facebook, blogs, search engines, website. And if you are using the post or the recruitment material, it should be placed at the top on the right side of the web page. Example for the banner or any kind of name like UT Southwestern logo or anything like that, it should be on the right side of the web page. And rich media ads, if you are using any kind of advertisements that include the rollover, scroll bar or anything like that, you have to use certain logos and everything in those. And if you go for paid search advertisements, you have to provide the purchased keywords relevant to the research study and appear on the search engine near the search results so that it will be easy for the participants to look for those keywords. And likely the information contained on the link page requires review, but not any paid search term. And if you are using for in-text advertisements, relevant keywords are selected for in-text keywords and which are highlighted in the content throughout the network site. And also any rollover keywords or anything pops up for the advertisements. These needs to be considered. So when it comes to the other social network ads, similarly, if it is a paid search advertisement, those needs to be based on the keyword searches by users and demographics from their profiles and geographic information from their computers and more. And if you are looking for the social networking pages, if you want to advertise, then not only ads on social network pages, but also those pages themselves set up for a specific study. So if you're in a Facebook, you can see multiple research studies that can be posted in social media like Facebook. And within that Facebook itself, there will be a specific page for each type of the study. So you have to see those pages and we have to see those pages as well. What type of content is posted in that page? And we have to see how do you get the access? What is the privacy settings on those pages? And is any protected health information being recorded? Or any HIPAA waivers are applicable? And is there any pre-screening form for this any participation of these specific pages? And how the confidentiality of this collected information is maintained? And for the blogs and posts, we should also see how the direct advertising will affect. And for the tweets and texts, how the direct advertising will affect within the participants as well. So these are the things we'll review when it comes to any kind of social media advertisements. So when it comes to the informed consent, how the social media will be used for their specific studies and how the research volunteers will be contacted. So one of the thing is you can use is electronic informed consent as if there are no waivers of informed consent. So what are the IRB recommendations for this? IRB must approve the method of consent, and that is the signature if at all we are approving the e-consent. And what it requires is language needs to be understandable for either participant or the legally authorized representative. And ease of access and navigation should be provided. And if any hyperlinks are available, that needs to be provided in the e-consent as well. And you always needs to provide a paper-based copy for the participants if it is available. And because what if the participant is not well versed with the use of social media? They need to have a paper-based copy. And opportunity to ask questions and consider participations are necessary. And these are voluntary participations. And questions can be answered either in person, over the phone, or by video conferencing, but should be answered prior to the consenting process. And investigators should assess the understanding of the study for participants and comprehension of all the elements of the informed consent. And participants should obtain a copy of the informed consent, and IRBs review the usability of e-consent process to ensure the ease of access and navigation for participants. IRB must approve the waivers if applicable based on the research. IRB must approve the method of consent and the signature is omitted if there is a waiver of documentation of the consent. If any other elements of the consent are omitted, then we can approve the waiver of alteration of the consent form. And an important aspect of consent relates to vulnerable population, including but not limited to children and prisoners. For these participants, it will be important to request that researchers provide information to prevent coercion and a means to affirm consent respectively. Finally, the provisions for reconsenting are necessary if the child comes of age during the study or if cognition improves or worsens during a longitudinal study in older adults. So what are the other IRB considerations when it comes to social media usage? So we always review private versus public data. Based on private information, if individuals intentionally post information on public accessible social media sites, such information would be considered public unless existing laws or the privacy policies are entitled hosting the information indicate otherwise. So for example, if an investigator proposes to analyze videos available on YouTube and will not interact with the individuals who posted the information, this may not qualify as human subjects research because all the posts may be identifiable and the data have been generated from public, not private materials. Especially if the content can be accessed by any user without specific permission or authorization being required from the individual who posted the information or from the entity controlled access to the information, the post can be considered public and therefore does not meet the requirements for identifiable private information, and it does not meet the criteria for human subjects research. So how do we see as an IRB, privacy and confidentiality? Investigators request careful consideration prior to initiating recruitment via social media platform to ensure protections of human subjects. Investigators should describe how privacy protections are put in place for participants. Investigators should describe how data is being collected, stored, accessed, and maintained for research where social media platform is used. Investigators should also consider the third parties may develop novel ways to breach the security of platforms and exploit the identifiers of account holders. So these are the considerations for the investigators when they are using social media platform for use in research. So when it comes to the risk and benefits of the social media research, here are the risks like the third party use of data such as tracking participants, clicks on advertisements, and breach of confidentiality through intentional or unintentional sharing of data by participants or the study team that can cause the confidentiality breach. And if sometimes exposure to any other fake content or malicious content, however, if the investigator is only using social media to recruit, then there is no additional exposure to the content outside what is seen from scrolling through their feed. Like if the social media is the only platform that they are using for advertisements, then that's the only malicious content. That's what we need to figure that. And when it comes to the benefit of this social media use in research, it is for ease of recruitment, increased engagement by social media participants, and rapid sharing of information in a way that is intuitive for participants and building web-based communities. Moreover, several studies have shown that web-based participation in research is more private than in-person participation. And what are the HRPP policies to facilitate safe and effective social media use? So UT Southwestern published social media guides to help investigators follow institutional policies, both privacy and security recommendations, and to help them follow best practice in social media use. So we have the social media team at UT Southwestern where they can help the investigators and provide the best content and what are they have the templates as well you can use for your advertisements. Same risk-based approach the agency uses to assure safety and effectiveness for other mediums such as newspaper, flyers, posters, etc. are also applied. The researchers must adequately protect the rights, welfare, and privacy of the prospective subjects. And to assure this, the researchers must include an explanation or statement in ERB describing the privacy and confidentiality, and also information practices of which platforms are used for collecting the data and storing the data as well. And to assure this, the researcher must obtain approval from social media and marketing team, digital and social media department via email. If any of the UT Southwestern logos or the Parkland logos are involved, then we will ask for a copy of the email that social media has approved those advertisements. The researchers should consider how their materials will be used by various social media mediums. Some of the recruitment services can place advertisements on website that the PI did not choose. Therefore, they should provide the information in a locked PDF format prior to the distribution. And please include about the recruitment plan, methods in the protocol, and also we have a place in Form C where you can provide the recruitment and consenting process and any ERB smart form pages if applicable. And here is the consent Form C where you can provide those if you are using the recruitment through social media, and also if you are using any advertisements. These are the screenshots, and this concludes my presentation. Thank you. If you have any questions or anything, we would love to hear those questions.
Yes. So this does conclude our presentations for today's session. So I'm going to pause for a few seconds to allow you guys some time to type up any questions. Okay, so while we wait for you to get those typed up, I just want to remind you of the survey. If you can just spend a few minutes to complete the questions, we will use the information to improve the content of these sessions and how we present them. We will also be able to see what areas we need to work on in the office and what areas we are excelling in.
And
So
we're also here. If you have any questions on social media use or anything, please feel to email us at hrpp@utsouthwestern.edu.
Yeah, thank you, Satish. So I don't see any questions at the moment. But if you do have any, you may email us. I'm going to conclude here. So I want to thank our presenters, Raj, Rasija, and Satish. Thank you all for attending today's session. The next Research Matters session is scheduled for June 20th. So have a great rest of your week. And there you go, on screen.